Did you know that a lot of mothers, after giving birth, new moms, second moms, older moms, suffer from depression after giving birth? And they suffer in silence and don't talk to anybody about it? Could you be one of those mothers? Please join me. I want to be able to provide you with support and education to empower you. Hello, my name is Eunice, and I'm an associate clinical social worker with Healthy Bump Club. It's a pleasure for me to be here today, and I'm so excited to talk to you about a topic that is very dear and near to my heart, which is postpartum depression. It's a topic that a lot of women, especially new mothers, don't discuss openly, and it's something that we need to do and we need to normalize in order for mothers to get the help that they need. So, a little bit about postpartum depression. A lot of women have asked me in my practice, what is postpartum? How do I know if I have it? Or how do I know if, I had it and I didn't get the help and I have probably had symptoms after I had my child? Or what if I still have it? How old does my child have to be? Like, these are all questions that I've heard throughout the years that I've been in practice at the clinic where I work, and just in conversation with other women that are mothers, as like myself. So, postpartum depression is something that happens. It's a disorder that happens after giving birth. There is a difference, and I want to clarify that there is another type of condition that happens after birth, which is called baby blues. So it's important for me to provide you with the education about baby blues versus postpartum depression. So let me give you some examples. Baby blues happens 2 to 3 weeks after you give birth. Baby blues happens on its own, very natural, and it goes away on its own in a matter of weeks, sometimes even days for some mothers. I know for me, when I first had my daughter, it happened maybe a week after. So, what happens with baby blues? You get a little sad, you feel emotional, you might cry over things that you probably wouldn't cry before. But it makes sense. You just had a baby, right? You just gave birth. So hormones are everywhere. Changes are happening in your body. So baby blues is very natural. However, postpartum depression is a more serious mental health disorder that I think it's extremely important that women are educated, especially new mothers or expecting mothers. Because with postpartum, it can happen weeks after giving birth. However, the difference between postpartum depression and baby blues is that it is persistent, it doesn't go away. The symptoms tend to be more severe. And if you don't get professional help, it can get serious and your life could be at risk. So it's really important that you get help, because with depression, it doesn't go away on its own. Like, a lot of people like to say, like, it's going to go away, just give it some time. Sometimes giving it time or buying time only makes the issue worse, especially for new mothers who need all the support they can get. So what are some of the symptoms of postpartum depression, you might be asking, right? So let me give you a list of some of the more common symptoms that we see in our clinic. So one of them is sadness, extreme sadness, isolation, having intrusive thoughts, negative thoughts about self, even your child as well, not enjoying things that you once did. So not finding pleasure in activities that you once did, having suicidal thoughts, and also feeling irritable, feeling hopeless, helpless. And sometimes some mothers also experience irritability and anxiety, like they just feel this angst and they don't really know how to describe it or how to put words to it. It's just this loom kind of dooming, kind of like doom feeling that they have that just kind of makes them feel like they have a cloud over their head. That's how I've heard it described before. Like, I feel like I'm walking with a cloud over my head, right? So just feeling like their thoughts are not very sharp, like they can't really think clearly. And that's a common symptom of depression. It's very common even with regular depressive disorder. So for a lot of new moms, if they're sleep deprived, they're caring for this new child, they might think that that's normal, but it could be indicative of postpartum depression. So it's really important that you screen properly. As a mental health professional who works with severely depressed people on a daily basis, I know firsthand that getting therapy and medications could be a great combination on your road to recovery. And there's no shame. I know a lot of new moms feel like, I can't take this time right now to go care about myself. I have this new baby, or what is my family going to say? Or what is my partner going to say? Or how am I going to be able to talk about this and not make it about me when I just had a baby and all the attention should be going to this baby. But let me tell you, if you don't take care of yourself, if you don't pour to yourself first, you can't pour from an empty cup. So you really need to take this information and do as you see fit, because this could really be a matter of life or death. There's been a lot of cases where a lot of mothers, have committed suicide or have done other heinous acts because they were suffering from severe postpartum depression, but they didn't talk to anybody. Nobody really took the time to screen them properly. And based on a CDC report that I read recently, a lot of women, 1 out of 5 reports that they weren't even screened properly when they went and saw a doctor. So we know that a lot of women are falling through the cracks, a lot of moms. So we need to make sure that we put this education out there, that we inform you and give you the tools that you need so that you can make a decision for yourself and for your child's life, because you deserve it and you're worth it. And most importantly, normalize mental health. Know that this is not a character defect. This doesn't speak negatively about you. This is a stigma, right? Why is it that it's so important to dismantle stigma? Because stigma is what keeps us out of therapy, what keeps us out of the doctor's office. It's what keeps us from getting help, from getting better, essentially. We need to get better. As mothers, we need to be at our best in order to be able to give and nurture our children. And postpartum depression will cause you to suffer. And you don't need to suffer in silence anymore. So you might be asking, well, you've explained the symptoms now. You've told me a little bit about the difference between baby blues and postpartum depression, Ms. Eunice. So how do I know if I have it? Well, that's where I really want to emphasize. I'm not here to diagnose you. I'm here to provide you with psychoeducation and information so that you, as an individual, as a mother, a young mother, a new mother, an older mother, whatever your status is, but if you are a mother, it's important that you seek professional help. Who can you go talk to? You can talk to your PCP. You can talk to a mental health professional and discuss what you're feeling. Discuss what are some of the symptoms. If the symptoms that I mentioned previously sound familiar or you've experienced them, talk about that. When you go in to see your medical professional, he or she could possibly use a screener. What is a screener?